Good day, everyone. You're watching the MD News Network. I'm Charlie Milburn. MDNews.com is pleased to share exclusive footage of former Speaker of the House Newt Gingrich from the American Hospital Association's Health Forum Leadership Summit. In his book, To Save America, Speaker Gingrich advocates for research reform. We asked him how he envisions such reform taking place, and here's what he had to say.
Well, at the Center for Health Transformation, we're trying to develop right now a fundamental breakthrough in how we think about research and how we approach it. We think the potential is so enormous in the next 20 years that we should, in a sense, break the mold. Now, when I was Speaker, while we were balancing the federal budget for 4 straight years, we set priorities. So we doubled the investment in the National Institute of Health while we were being very frugal in other areas. Essentially, you need 3 things. You need to have a research-based budget rather than budget-based research. You need to go to the scientific community and say, over the next 5 years, what's the most you could invest intelligently to accelerate the amount you're learning to save lives? Second, you have to, I think, have a much more managed and directed model than the NIH model that currently is. Well, you need to have something closer to the way the Human Genome Project was run, and to some extent the way the National Cancer Institute's run. Third, you've got to have a continuous flow of information from the National Science Foundation to the National Institutes of Health to the Food and Drug Administration for approval, and then on to CMS for use. And you've got to find a way to try to move knowledge from the laboratory to the hospital or the doctor's office, or for that matter to your bathroom cabinet, as rapidly as possible.
Next, we asked Speaker Gingrich how he thinks research reform might affect physicians.
Well, I think it'll empower physicians of the next generation with massive new capabilities. I mean, think about the collapse of the iron lung industry as the Salk vaccine and the Sabin vaccine eliminated polio. It was a remarkable change, and it meant that doctors had a one-visit opportunity to save people from dealing with polio the rest of their lives. There are a number of things we do today that are sort of miracles compared to 50 years ago. I have in my right eye a lens that was implanted after I had some eye problems. And the lens was made of a material which was invented in the early 90s using a device that had been developed in the early 80s. And it took 15 minutes as an outpatient, and then another hour to recover, and then a couple of days of going slow and having a patch over this eye, and then it was done. I now, for the first time in my life, have better than 20/20 vision.
Now that we've heard Speaker Gingrich's opinion, we want to know what you think. Visit MDNews.com and click on Share Your Perspective to tell us what you think. I'm Charlie Milburn. Thanks for watching MDNews.com.